Hi, and thank you for visiting our stand at the ROS Virtual Conference. I'm Sean Luchins, CEO of Optasia Medical, and I'm delighted to have the opportunity to introduce you to some of our team members and key partners. Optasia is a Manchester-based technology and services company focused solely on developing products for osteoporosis care providers and patients. We hope you've heard of our initial product, Aspire, an AI-enabled system for automated identification of vertebral fractures, developed with leading AI medical image researchers at the University of Manchester and leading osteoporosis clinicians from the Manchester University Foundation Trust. Last October, we decided to extend the company's remit and develop a broader range of tools and services for the osteoporosis care community. The change was driven by conversations with many of you at ROS conferences and events, Fragility Fracture Network meetings, IOF and NOF meetings, as well as detailed conversations we had every week with FLS and bone health teams. Through all of those conversations, we were struck by the deep commitment of care teams, whom were often working with very limited resources and long patient lists. Over time, we came to share many of the frustrations, including the frequently overwhelming admin load that limited time with patients, or, more concerningly, created disconnects in the care pathway that could lead patients to drop out. We understand that the ultimate measure of success is improved bone health, and that doesn't come from identifying the right patients at the front end of the care pathway alone. Successful intervention and continued adherence to care plans over time is required. With that in mind, we began developing two new products around this time last year, Optimal and My Bone Health, and we're pleased to have the opportunity to tell you more about them today. But our development efforts won't end with these products. We have more plans on the drawing board and will develop new capabilities to add to Aspire, Optimal, and My Bone Health. Next, we'll provide you with more detail on each of these products and introduce some key team members from our extended Optasia team. First, however, I'd like to thank the Royal Osteoporosis Society for all they've done to bring us together at the virtual conference. The Aspire AI-based algorithms were developed by the University of Manchester and Central Manchester NHS Foundation Trust in collaboration with Optasia's developers and with input from the Royal Osteoporosis Society as members of their bone health network. The research was funded by the National Institute for Health Research Invention for Innovation program. Already, thousands of NHS patients have had their spinal fractures identified, in part due to the Aspire algorithms. Here's Paul with a quick overview of the technology and how we got here. Paul Bromley is based in the Division of Informatics, Imaging, and Data Sciences, which is part of the Faculty of Biology, Medicine, and Health at Manchester University. Paul is a key player in the development of the algorithm.
On November the 10th this year, Osteoporosis International published original research from a team led by clinicians at Nottingham University Hospital's NHS Trust. This paper showed that Aspire, an automated vertebral fracture detection service that has artificial intelligence at its heart, can be successfully integrated into a fracture liaison service. The results have been verified by experienced radiologists, so this isn't just about software. This is where human intelligence meets artificial intelligence to produce a better result for the patient. Using Aspire, the radiology team can quickly identify every vertebral fracture on a CT scan visualizing the spine. This is crucial for the treatment of osteoporosis because we know that many people are walking around with these fractures and don't know that they have them. Vertebral fragility fractures are often the earliest clinical manifestation of osteoporosis and are a strong predictor of future, more debilitating fractures. More than half of hip fracture patients had a previous vertebral fracture. Now, this research marks the end of one phase in which technology has been developed to enable bone health teams to deliver best practice care to their osteoporosis patients. Crucially, it opens the door to the next phase of technology where huge strides have already been made. The news that independent research has verified the effectiveness and flexibility of Aspire has been very encouraging to the academic and clinical community here in Manchester, because it was here that the algorithm was conceived and designed, in a collaboration between the University of Manchester, the Manchester University NHS Foundation Trust, the Osteoporosis Solutions company Optasia Medical, with input from the Royal Osteoporosis Society itself. We had a large team working on the algorithm, including Professor Tim Coots, Dr. John Parkinson, Professor Catherine Payne and her team at the Centre for Health Economics, Dr. Eleni Kariki, and of course, the late Professor Judy Adams, who many of you will know was particularly passionate about identifying and reporting the presence of osteoporotic vertebral fractures. and was the inspiration and driving force behind the project. The development of the algorithm was a significant technical challenge, and a team science approach was essential. The team included physicists, engineers, computer scientists, algorithm developers, health economists, and of course, clinicians. The application of technology in this field is vital, and there is a significant technological component to the Osteoporosis and Bone Research Academy at the Royal Osteoporosis Society. The Academy has quite rightly seen that technology in itself is not the answer. It has to work alongside the care team and the patient, helping to deliver properly effective solutions in real-world settings.
Thank you, Paul. Now I'd like to introduce Eleni, a leading radiologist and clinician in the osteoporosis field and another key member of the Aspire development team. Dr. Eleni Karicki is a medical doctor who specializes in clinical imaging and healthcare informatics. Her clinical work focuses on musculoskeletal and osteoporosis imaging, with experience in adult and pediatric bone densitometry, as well as vertebral fracture assessment. Eleni is a member of the European Society of Musculoskeletal Radiology Osteoporosis Subcommittee and a member of the Royal Osteoporosis Society National Training Accreditation Committee. We asked Dr. Karicki to give us her views on how algorithm-based technologies can be used to help bone health teams provide best practice care for osteoporosis patients.
The first time that I saw the actual software in action, I was amazed by its ability to identify vertebral fractures. Our models and the software kept improving, but Paul and Sean were telling me it's not good enough, we can do better. From the beginning, I could see that Aspire would put a tool in the hands of radiologists that would complete many tasks and allow them to focus the time on accurate diagnosis and reporting of osteoporotic vertebral fractures. That is, focus on patients. The latest version of Aspire is even more amazing, because in the early days it worked with pre-processed images of the spine. Now you search for the examination images, and Aspire will find, format and assess them for osteoporotic vertebral fractures. In the beginning, we would wait a few minutes for the model to report the result, and now it retrieves the image, reformats it and reports it in just seconds. It is very fast and very accurate. The CT scans that Aspire works with are examinations that are performed for another clinical reason. For each examination, radiologists review all the images and report all findings, including incidental findings. That is part of our job. But very often, incidental osteoporotic vertebral fractures are not reported, and the few times that they are reported, this is mostly ambiguously. This means that people with such fractures remain undiagnosed. So now, using Aspire, we are finding people who have suffered fractures that otherwise would not have been diagnosed, and these patients for the first time can go forward for proper bone health assessment. What the software also does is offer an opportunity for standardization. There are guidelines for reporting examinations and findings, but guidelines are not always followed, and this is partly because people are involved. We are not machines, and we cannot expect everyone to do exactly the same or have expertise in everything. By using Aspire, we follow the guidelines, and we know we are following the guidelines. That goes a long way towards best practice. You do not need to be an expert to use the software, and with this software you do not need to be an expert to assess the spine, correctly identify and report osteoporotic vertebral fractures. Using Aspire also minimizes the time we need to spend on reporting the examinations. It is widely recognized that there is a shortage of radiologists in the UK and worldwide, so if you have a tool that will quickly do a lot of this work, that solves part of the problem. But, and this is very important, if we had all of the radiologists that we needed in the UK, we would still miss fractures. So yes, it will save time, but crucially, it will detect all of the fractures. That is not something that would happen otherwise. It will identify patients that need bone health assessment, and this too is not something that would happen otherwise. So Aspire is good for NHS finances and the high standards the NHS aspire to. Speaking as a radiologist, Aspire is good for our performance measures and to meet audit standards. Speaking as a medical doctor, Aspire is most importantly good for the patients, because you know that this time you will not miss anyone who needs bone health assessment. I really believe in this technology.
Thank you, Eleni. Now, I'm pleased to have the opportunity to introduce Optimal and My Bone Health, our recently developed connected care coordination applications. Optimal for FLSs and bone health teams, and My Bone Health for patients. The applications are the direct result of our experience working on Aspire projects here and in the US, and learning about the challenges teams face managing patient loads using spreadsheets and generic office software in meetings with teams throughout the UK. Last autumn, we began testing the idea by including a single image of a care coordination application in our presentations and outlining the functionality in discussions. We were struck by the consistency of the reaction, and after a handful of meetings, we began outlining the product in more detail. To ensure we were able to bring the highest quality products to osteoporosis care teams, we partnered with Avogen Health, who specialize in the development of care coordination software that combine both clinical and patient applications. We've now completed development of the Optimal software, and we are looking forward to testing it with interested bone health teams. When we began developing Optimal and My Bone Health, we couldn't have imagined the pandemic-related disruptions to normal care provision. However, we've developed the applications with the latest guidance from the Department of Health and NHS Digital in mind. They've been built as browser-based and public cloud-hosted applications and include the latest security and data protection technology. The combination of these make the products flexible and easy to use from any location, including home offices. From our experience implementing Aspire, we understand the challenges of integrating new technology with legacy hospital systems. For that reason, we've included practical ways for teams to benefit from reduced admin out of the box. For instance, patient lists from electronic health records can be uploaded using standard spreadsheet CSV files if required. We've also included form letters that can be customized by your team and auto-populated with patient or referral data for communications regularly completed by post. And of course, we'll take advantage of the opportunities to increase connectivity as new systems are rolled out. Now, I'd like to introduce Lisa Provan, Head of Clinical Services and Business Development for Optasia. Lisa and Rory Collier, Product Manager for the applications, led development of Optimal and My Bone Health.
Welcome to Optimal, the patient coordination app for fracture liaison teams and clinical workers in the field of osteoporosis. Optimal keeps everything you need organised in one programme, which is fully customisable to suit the way that your fracture liaison service works. The homepage can be edited to quickly view whatever you wish. The dashboard defaults to displaying alerts, upcoming appointments, patient enrolment frequency, and patient status. The buttons along the top of the screen indicate the different stages of the patient pathway. The numbers on top of the buttons represent the number of patients in that particular stage. This is a useful tool when you need to assess and reallocate your resources. This layout has been designed with the Royal Osteoporosis Secondary Fracture Prevention Guideline in mind and has taken many nurse inputs into account to make an app that works for everyone. Each of the buttons will take you to a list of patients who are currently in that stage of the pathway. Selecting any of these patients will take you into their profile. Links are easily established between Optimal and other systems, including those used by GPs, the FLS database, and Optasia's other solutions, My Bone Health and Aspire. Linking these solutions increase efficiency in administration, cutting down on time spent writing letters and double entering data. Auto-population of information further reduces the amount of time spent on data handling, so nurses will not have to spend hours each week manually inputting new patient data into the programme. All fields that are in the Fracture Liaison database are present within Optimal. This means that with a click of a button, your results are efficiently uploaded to the database. Pre-written letters can be uploaded to the software, and any relevant patient-specific data can be mapped into the blank spaces. These letters can be edited at any time and are based on each individual's fracture liaison services requirements. My Bone Health provides patients with a personalised care plan, comprehensive information about osteoporosis, including quick links through to the Royal Osteoporosis Society and NHS websites, as well as medication reminders, exercise and nutritional goal progress tracking, appointment reminders, and gentle nudges to help patients stay on track or feel comfortable getting in touch if they are struggling with any aspect of their care plan. With these solutions, Optasia ensures that the patients will not fall off the care pathway. By using the patient app, My Bone Health, and the professional clinical app, Optimal, we have completed the best practice care circle.
Thank you, Lisa. In summary, bringing together the solutions we've outlined today, we hope that Optasia's suite of osteoporosis-focused technology and services can help your team provide the best possible care in the changing environment. All of our tools are virtual and available from any location, in the hospital, in the community, or from your home. We hope to have the opportunity to learn more from you. Our goal is to bring the best possible technology, tools, and services to the osteoporosis community. We are always interested in learning more about any opportunities you see for technology to play a role in improving or extending care. We all hope to live long, healthy, and active lives. Expanding osteoporosis care to all those that can benefit from it is more important now than ever, as lifespans continue to increase and retirement age populations expand around the world. Finally, I'd like to thank all of our colleagues in the academic, research, and clinical communities for their support. And of course, on behalf of Optasia and all those in our extended team, I'd like to thank the Royal Osteoporosis Society for their continued leadership in the development of osteoporosis care. Thank you.